This is a video about the cost of braces. We often get calls or emails. Hello doctor, what would the treatment cost? And then I kind of have to say, listen, I just can't give you a reasonable number. It would be best to have an appointment where we can talk about what kind of treatment you want, where we can evaluate how your occlusion looks, how much time we would need for that, and so on and so on. I can give a very rough estimate for some standard situations. So like if it's just the front teeth that have to be aligned, usually we get by with about 4,000 or 5,000 Swiss francs. If we do a complete treatment, it's usually around 8,000 or 9,000, but these are just rough estimates. The individual case is always very different. Also, treatment durations are very different. Sometimes, because of different biological reactions, we can have a case or two more or less identical cases, but one will be finished within half a year and the other one will take a year or maybe even 1.5 years, because the teeth just move much worse. Or the compliance of the patient, like putting in rubber bands, is much lower in one case than the other, and that might be a reason why some treatments go much faster than others. And of course, if they go fast, if we need to work less, then the treatment will be cheaper. And if we have to do more controls and we need to work for 1.5 years on your teeth, then it will be more expensive. But as I said, rough estimates, smaller things, 4 or 5, comprehensive treatments, rather 8, 9. And who pays for that? Usually in Switzerland it's a private billing. It's the patient who pays for dental treatments, unlike medical treatments that go over the health insurance. Almost all health insurance offer dental insurances. If you have a dental insurance, we can always go over the dental insurance. Apart from dental insurances, private dental insurances, there are some few cases where we can bill the health insurance, like if you have a medical problem. And there's some few cases that we can bill directly to the Invalidenversicherung, and those will cover, or if it's an accident, the Unfallversicherung. But these are very few cases. And then if you live, for example, in Basel-Land, there is something like called the Schulzahnpflege, Kinder-Jugendzahnmedizin, and there we can bill over the Kinder-Jugendzahnmedizin, but it's very clear what indications, what malocclusions we can bill over Kinder-Jugendzahnpflege of your Gemeinde. And also they only subsidize you if you only earn a certain amount of money. So if you earn, roughly, that depends from Gemeinde to Gemeinde, but if you earn below 50,000, then they will subsidize almost the whole treatment for your kid. And if you earn 80,000 or more in your family, then they will almost certainly not pay anything at all, even if the child would qualify from the malocclusion point of view for subsidiaries through the Gemeinde. So that's it. It's very difficult to give you a good amount, a good estimation. The best I can say is roughly 4,000 or 5,000 if it's something smaller, roughly 8,000 or 9,000 if it's a bigger treatment.